Hello?
Hey, Dr. Flahees, Dr. Allen, how you doing?
I'm doing good.
Pretty good, pretty good. I know everybody got the coronavirus, fearing kind of scared. So, Doctor, you had sent me a text saying that you're thinking about giving it up. You think about holding off, or maybe not working for a while. I was just calling to make sure that that was true. I wanted to at least tell you what we were doing to give you some security on what we are doing. Just a quick brief of what we are doing. What we have done is we've created a. Sorry, I know it's a little bit noisy here at the office. We have implemented a what I call a coronavirus safe zone, of which we've anybody coming in with respiratory symptoms will be treated outside of the clinic. They will not be allowed to come inside the clinic to affect staff and or yourself. We have an outside agency now, I think, that I'm going to use for screening, where if there be any screening or testing, it will be done in the clinic outside and not be allowed to come into the urgent care setting. Thus, the regular chest pain, the regular, lacerations, ingrown toenails, or those things will be allowed, but everything else that's respiratory-wise will be placed outside in the tent, which is outside of the clinic, just as a reassurance to make sure all my staff and employees are taken care of. So let me hear your thoughts. I do respect your decision. I know I won't ask too much from anyone, because I know these are scared times. I myself have children, and I know you been doing it for a while and have concerns about your family. So what are your thoughts? What are your fears, and kind of what your position is at this time?
Who is going to run the outside exam?
Well, the way it works is they will come to the front door, and there's a security person outside to say, what are you here for? And if the individual say, I'm here for cough, cold, fever, and chills of any sorts, they will then be sent to the what we call the coronavirus pre-screening and safe zone, of which at that particular point there will be a physician that they talk to, like in telemedicine, or just to get a clear picture. Do they meet the CDC criteria for being testing or not? And at that particular point, if they do need, if they have been deemed to be testing, they then will be either tested outside and or sent to have the testing done at another facility, and or they would have the opportunity to get their medication. If they don't meet the CDC criteria for any type of a respiratory illness associated with the coronavirus, at that point they'll be offered the opportunity to get the medication there and then proceed to go on. But the conversation outside will be via telephone, and whereas it's an isolated event, it will not be a physician at that in that booth doing anything other than having a conversation to determine who needs to be tested and who does not need to be tested.
I have my own personal opinion. It's not only actually my own. It's done in other countries. Everybody who asks for a test should be tested. I'm not saying anything, but I am not thinking. So it's really scary for me. Even in the sheriff's department, they offer me a position where I don't have to meet with patients or see them. Give me a day or two to think about it.
Okay, all right, not a problem. I do respect your opinion. I know it's fearful, so definitely give me a call. Please let me know. I know Sunday is your day. We're doing everything possible here to protect the staff and protect yourself. Clearly, I can see the risk in that as well. I'll wait for you to call me back.
I will.
Thanks, now. Bye bye. So the front line will let you know that even the providers are afraid of this illness. I may be losing a physician secondary to the fear of the coronavirus, as I'm trying to keep everybody possible on the team to make sure we're here for you. We are hoping that Dr. Falahi does stay with us. As you can clearly see, even the physicians are afraid. Some of the colleagues are clearly closing their doors and only taking telephone conversations for the patients. Some of the pediatricians have done the same thing, closed their doors. It is very difficult out here on the front line trying to keep doctors available, as the new direction have been, don't go to the emergency room, come to the urgent care, trying to keep these doors open in the urgent cares with as much support as we possibly can, as it was then brought to us as the front line. You will get an opportunity to see what it's like on the front line. Hopefully there will be some masks given to us. Hopefully there will be some gowns given to us. Hopefully there will be some additional funding given to us. We don't know, but the front line is very difficult. We will keep these doors open. We will continue to try to take care of you. It has been a tremendous, challenging day, as today's videos, hopefully Facebook and tweets, will show you what it's like on the front line. I hope you continue to follow me as I give you a true idea, not an imaginatory, not a guess, from an owner of an urgent care with multiple doctors and multiple employees trying to keep the doors open for you guys during this crisis, as it's fearful from the physicians all the way down to the staff. And I'm commending all of the guys that are here with me today, and all the other two doctors that choose to stay in the battle with you to make sure that you do have a place to go. Stick with me, and I give you a day-by-day true experience of what it's like on the front line.